I'm sure you're wondering why I'm smiling so much. It's because we're at the dental unit of Claron Health International. We're going to be speaking with Dr. Michael Ewa-Mensah, and he is going to be speaking to us about teeth whitening and tooth discoloration. My name is Nanama Anna Bempong. This is Health Check, and we're on GH today. See you on the other side. Okay, Dr. Michael, you are welcome to Health Check. Thank you so much. So today, as I said, we're speaking about teeth whitening and tooth discoloration. Can you tell us a bit about tooth discoloration? Okay,
tooth discoloration is grouped into two main parts. We have the intrinsic type of discoloration, we have the extrinsic types of discoloration. So when it comes to intrinsic type of discolorations, there are certain materials that discolor the tooth when the tooth is forming during tooth eruption or when the teeth are coming into the mouth. So you can have certain instances such as tetracycline staining, certain antibiotics.
You have to say those things slowly. Okay.
Okay. You can have certain materials, certain medications, such as tetracycline. It's an antibiotic that stains the teeth when you're younger. You take it during childhood. So it stains the permanent teeth even before the permanent teeth appear within the mouth. Yes. You also have certain things such as tooth decay. It's a type of intrinsic discoloration. It causes some areas to be black. Yes, and you can also have trauma. Probably when you're younger, 5 years, 6 years, you fell down, you chipped a tooth, you never had it checked by a dentist. As you age, probably 18, 22 years, realize that just that single tooth is a bit grayish, or a bit brown, or a bit black. It's possible that the blood supply to the tooth has been cut short because of the trauma you had when you were younger. It's also one type of intrinsic discoloration.
So if you're younger, before your baby teeth come out, if there's a discoloration on that, should parents be concerned that it will transfer, or once the tooth comes out, we don't have that problem again?
You should be concerned. You should be concerned about it. There's one condition we call fluorosis. Fluorosis means high intake of fluoride in water. There was a survey conducted in the Bongo district of the Upper East region where they realized that their water sources had a lot of fluoride, excessive amounts of fluoride. So the ingestion of fluoride at very, very young ages, by the time the teeth appear in the mouth, they are more yellow in color. So the research actually realized that it was their water bodies or their water source that had excessive amounts of fluoride. But this should be confused with fluoride used to brush the teeth. Yes, it should be confused because that's actually a topical form of fluoride used to brush the teeth. So you shouldn't confuse the two.
So what can one do? You mentioned intrinsic and extrinsic.
Yes.
What can one do to help with the intrinsic, and what can one do to help with the extrinsic to stop the discoloration?
Yes, when we talk about extrinsic, there are certain materials that discolor the teeth when the teeth are already in the mouth. So you have certain foods such as carrots, red wine, coffee, tea. They contain tannins that discolor the teeth over a period of time.
Carrots?
Yes, carrots also discolor the teeth. Yes, and also plaque deposits. I can't forget about plaque. Plaque also discolors the teeth over a period of time. Hence, you need to see your dentist every 6 months. So with intrinsic and extrinsic, you need to know the root cause of the discoloration so you're able to tackle it from the grassroots.
So once we do that 6-monthly check or a biannual check for our teeth, you'll be able to discover whether there's any issues or discoloration and things like that. I was told that you can use things like baking soda, banana peel. They said, I was reading that if you rub the banana peel on your teeth for 2 minutes, it regularly, not just like once and then you just leave it, like regularly. And then also Vaseline as well. These home remedies, do they work?
I wouldn't dispute the fact, because with the banana peel, it's just mechanically removing deposits from your teeth. It's just like using a toothbrush. It's just a mechanical removal of plaque deposits from my teeth. Because our grandparents knew a lot. They were using the plantain stalk and they were using the charcoal. So the plantain stalk served as the toothbrush now we know we use for brushing teeth, and the charcoal served as an antiseptic to try and reduce the bacterial load in the mouth. But those were the foundation for keeping a good oral hygiene. But now we've developed upon those foundations, and we are using the toothbrush that's quite effective, and the toothpaste containing fluoride.
Okay.
Yes.
So once you've done all of that and still your teeth are discolored, are there varied like levels of discoloration, or is it like it's yellow is yellow?
Okay, so the natural color of the teeth is not supposed to be extremely white. You should have a little tint of yellow in the teeth. So you could be yellowish white, yellowish gray, grayish white.
So there's a color chart for teeth.
You have different shades
okay.
of teeth, yes.
Okay.
The reason why you have a little bit of yellow in the teeth is that one of the layers of the teeth we refer to as the enamel is the outer protective layer of the teeth.
Okay.
And beneath the enamel is another layer we term dentine.
Okay.
Dentine is naturally yellow in color.
Okay.
Yeah, so take the enamel to be like frosted glass. You can't see what's behind it, but light can penetrate through it. So whenever somebody smiles and you see a little bit of yellow, it's probably that the dentine is being reflected from below, and that is naturally yellow in color. Okay. So there are so many factors that affect how somebody perceives teeth to be white. So everybody has a little bit of yellow in the teeth, and as you age, your teeth become more yellower because there's more deposition of the second layer within the tooth, and you perceive that to be yellow.
So it's not like it's wrong for your teeth to be off-white?
No, it's not wrong.
Then we've been brushing our teeth like that for some. So as you said, as you get older, the dentine also changes, builds up.
Yes,
okay,
it becomes
then
more.
okay. So what can we do as we are growing older to? Is it possible to reduce the coloration of the dentine or something, or?
No, there are actually certain processes that you could do to enhance the color of your teeth. Okay. We have certain materials called dental veneers. They are these thin laminates or thin wafer thin objects that we place on the surfaces of the teeth to help to improve the aesthetics of the teeth. We have certain materials such as crowns, porcelain crowns, that are also used to cap the teeth to give a better aesthetic. You also have teeth bleaching, but with teeth bleaching, you need to make sure that the patient doesn't have any pre-existing sensitivity, and you need to manage the patient's expectations before you do it, because certain patients may think that it's a permanent way to get whiter teeth. They think once it's done, it's going to stay there forever. No. So you consider getting permanent options such as dental veneers and dental crowns. But
that's if it's like very severe, or even if it's not?
If it's not too severe, you could still have that done.
Okay.
Yes, but you need to assess the teeth properly. You don't just go in for that. You need to get a dental professional to assess all that before you go ahead to do it.
Okay. Yes. I mean, these days now, people use like whitening, like they have whitening sessions with maybe in their home or something like that. Is that the same, or does it have the same effect as the veneers? Is it a cheaper option?
Okay, so bleaching is a cheaper option, and it's also temporary. With bleaching, there are two types. There's one done within the dental clinic. We call it the in-office type of bleaching. And we've got the home type of bleaching. So the difference is both of them use the same chemical, that's hydrogen peroxide or carbamide peroxide. But the concentration is the key. The one used at the office is around 37% hydrogen peroxide, but at home it's less. Yeah, so you start at the office, and when you get home, you do a top-up at home to maintain the teeth at a certain shade.
So it's not, you don't have to keep coming, you can do it yourself in the house?
The concentration at home is a bit lower, so there are times that you still need to visit the dentist to have a top-up than there. Yes.
Okay.
Yes.
So would you recommend to do that than the veneers, or it's more like it depends if you want a permanent or a temporary solution?
Yes, exactly. It also depends on the patient's expectations. If he or she wants a permanent way, you go in for veneers and crowns. But if it's temporary and he or she can afford to be coming on several visits, you can go in for the teeth bleaching. But you need to try and manage the patient's expectations and know the root cause of the discoloration. Okay.
Yes. But are there any side effects of bleaching? I mean, with sensitivity and things like that?
Yes, there are side effects for teeth whitening or teeth bleaching. You could end up having sensitivity over a period of time, but there are certain gels or materials that can use to curb the sensitivity. Okay. It's also associated with recurrence. As I said, it's not a permanent way to get whiter teeth. Yes, the original color of your teeth can come back. And if it's not a dental professional or a trained dental professional who does it, you can end up having sores on your gums, because there are certain materials used to protect the gums during teeth bleaching and teeth whitening. So all these things need to be assessed during the process.
Okay. What other things do you think people need to know about tooth discoloration? We spoke before about foods and things, yes. But are there any foods or any activities that people must engage in so that the discoloration will be less or the process will be reduced?
Yeah, so I advise that you always visit your dentist every 6 months. You should visit the dentist to check to see if there's anything that could be done in terms of probably cleaning, okay, to take out some of the plaque deposits, probably doing the veneers for the client, and also advising the client on certain oral hygiene instructions such as brushing twice daily, flossing your teeth, because you know some of these food substances can discolor the teeth. So if you decide not to brush for a week, you can imagine what could happen to your teeth.
Okay.
Yes.
Okay.
Yes.
A lot of people now, they're trying to be healthier smokers if there's a way, and they're using e-cigarettes. Yeah. Can e-cigarettes be something that can also change the color of your teeth?
Yes, e-cigarettes are these electronic devices that we use sometimes if you don't want to smoke cigarettes. But with e-cigarettes, it has an effect on the teeth. Certain flavors that are used contain propylene glycol, and this is a known chemical used to cause the mouth to be dry. And dry mouth is one of the major causes of halitosis, that's bad breath. Okay. Dry mouth can also cause gum irritations or gum inflammations as well. And certain e-cigarettes do contain nicotine. Nicotine is one of the major causes of gum disease. Yes, so we should be careful about certain e-cigarettes we use. And it's also known to cause lung injuries when you're talking about the whole body, so we should be careful about that. Yeah, sure. Yes.
And then, like you mentioned earlier about our grandparents and things like that, they were using things like charcoal, yes, to brush their teeth, yes, and chewing stick. Yes. I see people walking around with chewing stick, brushing and things, and they're not using their toothbrush or toothpaste. Yeah. Is that a recommended thing to do? Yes, so or to whiten your teeth?
Using the charcoal, the wooden stick, it's not bad, it's the fundamentals, but we have newer and improved ways of getting a good oral hygiene, and that's the toothbrushing. So I wouldn't tell people to stop using the wooden chewing stick. It's equal, it's good, but it's not as good as using the
So it's a supplement rather than a replacement?
Yes, yes.
Okay,
yes,
I'll let my grandma know. Okay, and then the charcoal too, because charcoal does a lot of different things like sweat and all that kind of stuff, and now the teeth too.
Yes, so charcoal serves as an antiseptic in keeping a good oral hygiene, but certain products now contain charcoal. You have certain toothpaste containing charcoal, but you should bear in mind that such toothpaste may have a higher amount of abrasives in it. And these abrasives are used to take off deposits, but if they are a lot, they may end up wearing away the outer protective layer of your teeth. So you should be careful about such products.
Okay, so the best thing I think is that every 6 months we come and see you here or any other dental professional, and just make sure that we are brushing our teeth twice every day.
And with the fluoride toothpaste.
With the fluoride toothpaste. Yes. When I go home, I'm going to check to make sure that mine is fluoride, because I just pick any toothpaste and use it. And I'm sure you're writhing in your seat right now, just thinking, Okay, so that's good information for us to know and be able to keep our teeth from becoming discolored.
Yes.
Dr. Michael, thank you so much for your time. I'm really grateful.
You're welcome.
Thank you. Thanks, Doc. Shining. That has been me, Nanama Anabempong, on Health Check on GH Today. I've been speaking with Dr. Michael Owa-Mensah at Claron Health International, and we've been talking today about teeth whitening and tooth discoloration. See you again next time.